with the talk. Okay, I had my slides messed up, so this time with with Mr. Ballard's help, we were able to set up correctly. So you should be seeing a slide called gastroparesis and ion channel. So ion channels are everywhere. Last time I got you sick with all the ion channels that start from the brain to the heart to everywhere else. But I had forgotten one, that there is one that goes even in your stomach. No, there is a nerve that wanders all the way from your brain to your intestine and your testicles, called vagus nerve. So this is, and there are ion channels that causes gastroparesis, means your stomach doesn't empty. So they can record the digestive contraction, which are slower than heart. But if there is a problem with that, you start throwing up and you get constipated and bloated. So there are like channels, and this can occur due to Ozempic. So that is very timely information. Enough for that. Now this, okay, so I'm sorry, this so, and there are actually even pills that you can, apply to your skin, which can record EEG and EGG, So there is an electronic, depending upon where you put the patch. It's not really a pill, it's just like a simple cutaneous patch with tiny electrodes. So if you record on your brain, you can record brain waves. So it's like, I don't know what value it is, but so that's one of those things that people are doing a lot of self-monitoring, a little show and tell. Now this is very important because right now, maybe I should send this to the Supreme Court. Please take a time and read this article link. It's how science, why people sometimes get skeptical about science. This was a gay cure that was practiced by a neuropsychologist at Tulane University, okay, to convert people from their gay tendencies. And he, tiny amount of electricity applied to the brain, and he went on, along with mind control and talk therapy, and he even, did experiment. He hired a prostitute and had this gay man, by stimulating his brain, said, okay, now you have a heterosexual sex. So he gave him exposure, and obviously he was able to perform. The biology is biology. He couldn't get ahead with his higher testing, but eventually it didn't work, So it was like, and he was highly reputed. He even wrote a book called Pleasure and Brain Activity in Man, a guy named Heath. Okay. So, and he was really literally accused of mind control and practicing Nazi science. He was using prisoners and as his plaything. So that just goes to show you as to how, and this story has been blotted out of history of psychiatry almost, So I think maybe the Supreme Court should look at it, So maybe that might influence that if you're, it's impossible to cure something that you're genetically hardwired. And I missed this slide also because this is interesting. This is a fruit called miracle fruit that is in Nigeria and West Africa by the Yoruba tribe. It can turn sour taste into sweet, okay, because the one is, exposed with ion channels, another is through receptors. So even if you chew this fruit afterwards, and then you eat lemon, it would taste sweet. So let's literally call miraculin. So this is due to proteins work slowly while ion channels work fast. So that is the principle on which it works, So it's how this works around. So it's called miraculin fruit. You cannot import it because it is regulated by the FDA as considered food substitute or what have you, But sometimes it's used as a sweetening agent by some companies as a powder. So I missed that slide. Apologize for that. And now this is, remember the Sonny and Cher song, The Beat Goes On? That's not what we're going to be talking about, okay? Or that, I remember this old rock and roll song by the Trogs. I don't know, the wild thing, you make my heart go, So, but this is nothing to do with, we're going to talk about the good old cardiology. And this is three things. I'm not going to talk about the whole cardiology. I sent out the slides of my talk that I did for bioengineering department several years ago at USF. So For those who are interested, you could look through that. But if you're going to talk about electricity in the heart, the few things, this fancy word, sick sinus, that has nothing to do with your sinuses in your head. There is a sinus node, which is the master control, electrical control, and that's the common cause of fainting. Okay, if you pass out and your the heart doesn't beat, you end up with pacemaker. A very common illness as humans as we get older. So it's called sick sinus node. I'll talk more about it. And so that is a common cause of fainting and passing out. Okay, other than just nerves, or getting sick. Atrial fibrillation, very common cause of stroke. Again, important electrical emergency. Sudden death, obviously very important. And for that, pacemaker. And this fancy word means automatic implantable cardioverter and defibrillator. Okay, so the most important things that are essential for heart we'll talk about. But just, I'm not going to assume everybody knows everything. This is the basics of heart. 4 chambers. Okay, unlike other animals which have 3 chambers. Okay, left side, red oxygenated blood, blue blood. Those two shall never mix. If they mix, then you get blue babies, basic principle. Okay, so this is pulmonary circulation. They pick up the oxygen, goes around everybody, and then goes out through the aorta and down around. And so that's the basic anatomy and physiology. Okay, so normally these two do not meet unless you're born with whole. Okay, but that's not, this is the mechanical part. We're not going to touch that right now. But just to go over the electrical part of the heart, this is called the SA node, sinoatrial node. It's up in the top, corner underneath the big tube called superior vena cava. There's the blue blood right there. There are a certain group of cells called pacemaker cells. That's what, if you can say it, that is the Mother Nature controlling life. That's where it starts. The automaticity is the command center, pacemaker cells. It creates the a beat that keeps you and I and every other animal alive. And then nature, unlike Tampa Electric, gives backup on backup. There's like a relay station in the middle called AV node, atrium and stop chamber, ventricle bottom. That is a node. There are a few cells. So if this fails, this will take over. Okay, at a slower rate, but it'll work. It's like buying a generator during hurricane. Okay, the same way. Now, what if that gets diseased or scar tissue, okay, or damaged, okay, during surgery or anything like that? So then also the lower part will beat at a much slower rate, but idioventricular rhythms, this will beat, just like only the essential things will go on. So the rates are so there are backups on backup. This is the wiring of the heart. That's why it's painted in yellow. Okay, moving on. And this is called the action potential. We talked about action potential in the brain. Now there are various phases that take place. Now these are numbers may look goofy. We'll start out with backward. Number 4. This is spontaneous depolarization. Means for whatever reason, it's automatic. The current goes in and out, and it just gets back to the right level of something called threshold. Okay, so that's why this was so bizarre to the scientists. They named it funny channel. It has a slow leak. Okay, and it's never at rest. It's kind of a restless soul of cells that goes around. It starts leaking again, back again, starts again. So there's spontaneous. And then when it gets to this level, it goes further up and crosses potential. Okay, so phase 0 is depolarization. That has all to do with we bow our head to calcium. Calcium channels open, sodium leaks, okay, and influx of calcium into cells, phase 0, okay. That's what gets, the impulse going, okay. Then phase 3, calcium channels close again, and then potassium channels open. Potassium is inside the cell, it gets out. And again, it backs down to the resting potential, okay? And so this cycle goes on. And now you can say, well, what happened to number 1 and 2? The number 1 and 2 are inside the regular cells. And the reason is because the potential goes up very abruptly. You can see the slope, okay? So these are the muscles, these are the workers, This is the queen or the master control. This is electricity. This is, the mechanical energy. So electrical, mechanical. So you can just see how it goes up and slowly comes down. So that's the difference, okay, between the two. And so the big difference, less sodium channels, more sodium channels, less calcium channels, more calcium channels, slower depolarizations, lazy going up to the threshold, and fast depolarization. Rushes quickly, goes out. Okay, so those are the big differences. That's what life and heartbeat is. Okay, and again, these are muscle cells. Now, unlike individual muscle cells, which is your biceps, these are all work in synchrony, just like a big orchestra. So it's a striated muscles, and there are something called this little disc. So they work in cooperation. It allows the muscle to contract in a wave-like pattern. Because, as I mentioned earlier, life started in the ocean, perhaps, okay, and it's like a waveform that all wave-like pattern works as a pump. And there's something called the gap junction, okay, and then muscle fiber allow the ions to flow from one cell to the other, okay, so it's electrical coupling. So this is what's considered, I may have mentioned in the first class, the society of cells, okay. It anchors cells and do not fall apart between stress, so contract in a very cooperative behavior. Okay, so this is how the life, even the cells are interconnected and depend upon each other. So if few of them turn bad, we'll talk more about it when we address cancer. Okay, and this is the same thing for a lot more complicated. I'm not going to dwell over it, but this is timed precisely like a clock where 60 beats per minute generally. That's but it can go up to 100. So that's considered a normal range. Okay, and so there are the calcium clock, but this is now the more important thing is when these channels in electricity goes right. That's when you get into trouble. Now we've all heard from time to time sudden death in athletes. Okay, a well-known hockey player and a well-known basketball player, they all keeled over in the prime of their life, and even a rock and roll singer called Meatloaf had the death on the stage, and this occurs due to abnormality of this rhythm. If this depolarization and repolarization and the ion channels misbehave, that's when short circuit sets up, and just like would happen in an old house, that can occur. And a lot of them, these can be due to the electrical abnormality or mechanical abnormality. If this muscle is a little bit thick right there, you see the arrow, then the blood doesn't get out, and this is then you faint also. And if the blood doesn't get out, the oxygen level drops, and then the cells don't like it. They don't get enough, energy, and that's when they develop short circuit. And the famous example of that was a basketball player named Hank Gathers. He was on medication, but he stopped taking it, okay, because it slowed down his performance. And sometimes this is what I've done most of my professional career. This is normal electrocardiogram. You can see how the action potential is. But here it is, goes up like a little slur. You can see that wide QRS. That means there is a short circuit signature. You can see the wires are touching each other somehow. And that is, in medicine, we like to name it after people. So 3 guys who this is called Wolff Parkinson White syndrome. Okay, and there are varieties of syndromes that take place, which, but this is not a medicine class, so I shan't dwell too much into it. And the same thing, this can occur if there can be abnormalities of this genetic abnormalities of this ion channel. And the same thing can occur, when you get hit by lightning, it causes this massive static electricity from environment and causes short circuit inside this. All these cells get traumatized and develop short circuit. So these are, and I've had my share of dealing with this. Okay, just when I was starting out in practice, there was a young girl who said, who was in a fender bender, and she was not a driver. She told her sister, "I think I'm going to faint." She did faint. She had abnormalities, and unfortunately or fortunately for her, she survived, but was brain dead and lived on respirators and other things for almost 9 months. So it can be a very tragedy. And even worse is sometimes you can get something called locked-in syndrome, okay, with sudden death. And so that's, and I think I talked about a Frenchman who was paralyzed neck, and only thing that he could move was his eyelid, and he wrote actually an entire book based on it. Okay, so that's, it's an interesting story as to how medicine can save life but can create new diseases. Okay, anyway, so this is prolonged QT syndrome, and this was associated with an allergy drug back in the 90s called Selden that caused these abnormalities of this impulse here and caused short circuit and sudden death. Okay, and so now all the drugs that are marketed have to be tested for effect on their electrocardiogram. And this occurs with varieties of heart rhythm drugs also. Okay, and the starting example was quinidine or quinine, which was used for heart rhythm. It can occur with a common antibiotic that people take for bladder infection called Cipro. Okay, a lot of the antidepressants can cause this. Okay, so this can, so the drugs can have a lot of side effect because it can affect on it. The same way we talked about dilantin last time that can cause the same problems as well. Okay. All right. So if that is not bad enough, this can occur, occurs usually in teenage boys, or their sternum is not well formed yet, there is still cartilaginous tissue. Okay. So if they get hit by a football or a hockey puck or a baseball, it can set up abnormal heart rhythm called ventricular fibrillation. Okay. And there have been about at least 20 or 30 cases that occur per year that unless you are resuscitated promptly, you could get up. It is called, the fancy word is called commodia cordis. Okay. It's shock to the heart, basically. So it's a Latin this thing. And for those who are interested, watch this YouTube video there. For sake of time, I shan't show this entirely. Okay. If that's not bad enough, there's in Southeast Asia, primarily Thailand, there was almost a rash of deaths, of sudden deaths. Back in the 90s, this were described. They've been known in the culture for a long time. And this is people just woke up with bad dream and fright and died suddenly. A lot of young people died. And this was due to a sodium channel mutation that took place. And there was loss of function, and they developed short circuit and died suddenly. And this was again, later on, it was discovered when the genetics was isolated that this was known and described by a couple of Italian cardiologists named two brothers. They were both heart doctors, called Brugada syndrome. And the abnormalities are very subtle on the cardiogram. You can say, well, there's not a heck of a difference, but you can see this little point is up. And one has to learn with training pattern recognition to be able to tell this while you're reading. You can see that between the normal and abnormal, there's a very subtle difference, that and so this was encountered. So finally it was put that maybe somewhere along the line the mutation had occurred separately in different ethnicity or whatever. So we've talked a lot more about the sudden death that can occur. There are varieties of devices, but we'll address more in the next few slides. Devices. And now devices are all over. Primarily, we started with heart. Okay. The earliest pacemakers were right on the tail of the discovery of electricity. This where people had gotten the idea of directly stimulated. I know a German scientist, when they were doing surgery for heart for tumors, and luckily he had a patient who had a tumor in the chest, and the chest was open. A woman, unfortunate lady named Catherine Serafin. Okay, and obviously it was with direct stimulation was done during surgery, and he was able to stimulate the heart. Okay, so that was considered the first pacemaker. This is before really open heart lung machine and anything else. You can just see this was as far back as 1878, and this idea was later on incorporated by Dr. Albert Hyman in the United States in 1930s. Now, And this was the first pacemaker. You can see this picture, okay, how bulky that is, just like the electrocardiogram, okay. And so this was, and then subsequently, Dr. Zoll had done experiments as well in New York area, okay. And so these are some of the earlier pioneers who were done, and some of them weighed as much as 7 or 10 kilograms. These were hand cracked, but again, the AMA was conservative. This was interfering with God. This is, the United States was obviously a lot more religious. No, so he was not well supported. And then after the Manhattan Project, people had the idea of using a nuclear powered battery also. So think about going around with a little small amount of plutonium in your chest. But then subsequently, lithium batteries became more in vogue, and that changed the whole power source. So that is okay. Now that gets to even a more fascinating story. Okay, uh, Dr. Lillihei was a pediatric surgeon at the University of Minnesota, a very colorful chap, very pioneer. Okay, and during now obviously they operated on babies with hole in the heart, and during electrical blackout, the wired pacemaker failed, so he went to the friendly electronics repairer who had a small shop near the university, and asked him to help solve the problem. Okay, and this gentleman's name was the one with the checkered shirt, named Earl Bakken. Okay, now luckily for him, for humanity, he had read popular electronics and read about the early days the transistors were discovered in 1950s at the Bell Laboratories, and he had read an article about it in Popular Science magazine. So he said, "Okay, Doc, I'll see what I can do." So looking at the piano metronome and this little transistor, he rigged up a device and showed it to Dr. Lillihei. And next week, Mr. Bakken was shocked that Dr. Lillihei had already used it in the operating room. There was nothing like a approval from the committee or anything, but it worked and saved life. And the rest is history. And Mr. Bakken went on to find a little company called Medtronic, which controls 90% of the pacemaker and a stimulator market all over the world. So that's a fascinating story about Chan's discovery of combining computer science, transistors, and electronics.
I was a blue baby.
I'm sorry?
I was a blue baby.
Oh, wow. Well,
I didn't know anything about that, so now I can look it up.
Yeah, yeah, I think, and it usually depends upon, like these abnormality. I don't know which one you had, but most likely I'm guessing it was a tetralogy of Fellow, okay, which was discovered, by, where the surgery was done at Johns Hopkins, okay, earlier. And I think if you see the slides that I sent you about the technology, it's a fascinating story about, how racial discrimination was there, because an African American surgical assistant was not allowed to enter Hopkins through the main door, but he was an able assistant, and there was a movie made after him also, something that the God made, so then finally he was recognized after civil rights. So it's a very fascinating story about race in Maryland at the famous Hopkins, and
Cool.
so you'll enjoy that, and it's very common with the tetralogy of Fellow, because the surgery is done close to the AV node, the middle layer, so much more likely that you're going to get slow heartbeat. Okay, so that's obviously, it has become a lot more sophisticated, but that's one of the most common abnormalities. So I don't want to digress too much because I have a lot of other electricity material to cover. And now, in the same time, various people are trying to resuscitate the heart when it stops. And in 1947, the early open chest shock to the heart was delivered, and you can see the classical, like something that you'd use the kitchen, the two paddles that were used with the handle and the electricity that was generated. And these people had able help from engineers who were either their family members or their friends. And the external defibrillator, again, was massive, weighing 120 kilograms and delivered 500 millivolts alternating current jolt. Okay, all right. So this was, and then later on, this work was carried out by Dr. Zoll, who we mentioned earlier, and Dr. Bernie Lowen, who was at in Boston. I'm sorry. Okay, and Bernie Lowen had another. It's just to credit. Not only he saved lives with the defibrillator research and alternating current, he and along with so many others were pioneers in, preventing, reducing the use of nuclear weapons. So they were the committee of physicians to reduce nuclear warfare. They were recipients of Nobel Prize. Okay, as there was during the Cold War, there was a big this thing, and then varieties of other currents were tried, reducing the, improving the voltage and changing. And again, this was helped by other engineering friends of his, about delivering the precise shock to convert what is known as atrial fibrillation. So some of you may even have had a shock for atrial fibrillation. So that is, and that's done. And I've done my share during, my practice. Okay, I know we do it under anesthesia, obviously, because it's not fun to have a 100 joules shock to your heart. Okay, but it does save your life, and it can be, a boon or a blessing type of thing sometimes. Okay, so, and as we saw that sometimes we can create, what we call derogatively heart-lung machine, because we could resuscitate the heart but not the brain. Okay, and that's, because it's a 4-minute window that we have. But again, so this was, the big advance that took place. Okay, now hopefully these are impulses in electrical when I say it's not nice and normal like top down this thing. When you get ventricular fibrillation, hopefully this will play. Okay.
There's no sound. Is that intentional?
No, yeah, there's no sound on this one, sorry, because it shows the waves, it's an electrical. See how chaotic the color pattern looks of the waves? So they've mapped the electricity, and with computer enhancement, they've sent. So this is chaos inside the heart. That's when you get the ventricular fibrillation. So this is what this is research tool type of thing as to how chaotic that looks, so it's almost like a river or ocean after a storm, So this is, a real, laboratory science with combining with technology as to how the color represent the transmembrane potential. The voltage across the yellow indicates the large, and the dark red represents the resting level. So this is, just a little show and tell for how chaos can occur inside the heart. And there is a whole new science of chaos theory, but I don't want to digress too much onto it. Okay, and this is again, the shock can save life, but it's also some damaging effect. We showed you the wavefront that occurs, but it can also cause damage to the cell, can cause pores inside the heart. It can cause leakage of the ions, calcium overload. So you can create like a circuit that you're converted in one, but you cause enough trauma, so the circuit starts again. So you end up doing multiple shocks. Okay, that's why when we do the resuscitation, we start out with the lowest possible energy and then go up from 100 to 200 to 400. Okay, and it can be a real challenge to break this short circuit or abnormal wave formation that has taken place. Okay, and sometimes, so after multiple attempts, there is enough tissue damage, okay, or the energy imbalance that has taken place that you just realize that, yep, we've done all you can. And the varieties of causes are, lack of blood supply, inflammation, as it can occur from virus damage, scar tissue, okay, and again, the problem with energy and metabolism. I gave you the example of licorice earlier, that you can mess up with potassium and can cause, it can be fatal. And the cell death, when enough cells have died due to heart attack, you could give as much electricity as you want, you're not going to succeed. So that just shows that, it shows the limits of our technology. Okay. And sometimes, if you really want to get desperate, you just have to hook the patient up to like a device at the same time, artificial heart lung type of thing. Okay. And usually that is done during a drowning or when you're, so you'll never quit unless the temperature is normal. Because there was an example from a skier in Norway. They did resuscitation and kept the person alive for 1.5 days almost. And she did wake up eventually and went on to become physician at the same hospital which resuscitated her. So it's a fascinating story. So you never quit unless the body's temperature is back to normal. That's the axiom. Okay, this is something new that, now we talked about electrical disturbances, but when the heart is failing, okay, then they are congestive heart failure. We're reasonably successful in saving people from heart attack, but when the pump is damaged and when the medications don't work, there are something called baroreceptors inside your neck, okay, that respond to your stressful stimulus, okay, like a stress and like flight and fright response causes adrenaline, so it's called autonomic reflex. So people have thought about this is something called, this is relatively new, it's called baroreceptors that controls with difficult to control hypertension as well as congestive heart failure. So this is like when all the medications have failed, this reduces the adrenaline response. When you're being chased by a dog, adrenaline is good, but when the heart is weak, having too much adrenaline is not so good because you're like whipping a tired horse. So this stimulant device called barostim device, it's a generator that is placed under the skin, as you can see, number 1 here. There is a wires that are connected with this baroreceptors inside your carotid artery up here, okay? And then the signals slow down the pulse rate sent to the brain, regulating blood pressure and stress on the heart. So this is useful for, now whether it improves the quality of your life or actually prolongs the life is still the jury's out, but the companies are selling this. The costs are nothing to sneeze at. They're about $30,000 to $40,000. Okay, but this is called barostim device that you may hear about. Okay, moving on, getting away from the heart. The next important organ. Everybody recognizes this picture? Okay, anybody?
Yeah, it's an actor. It's what's his face?
Okay, how we
Jack
forget
Nicholson.
Jack
One-
Nicholson.
Yeah, Jack Nicholson. Yeah.
Okay,
Really?
one flew over the cuckoo's nest.
Yep.
Okay.
The movie that made him superstar, the type of thing. But he was not the first one. It was Ken Casey book that we talked about. I think Kevin Chittum and I did a class on 67, 68, and where we talked about Ken Casey, and this was the movies was coming around that time. So this is was a classic movie that turned a lot of people off electroconvulsive therapy. But this is not anything new. It was started by Italians right on the discovery of electricity, by an Italian psychiatrist named Ugo Sarlatti. Okay, they had found a patient who had schizophrenia and applied shock to his heart, and obviously, it was, he says the patient was not exactly happy, Okay, those of you Italian, non una seconda mortifera. Oh, not again, it will kill me. So, but they did try again, obviously that was not exactly, human resources were not very strong committees. So, and he did get better and was discharged from the hospital with improving, he was schizophrenic. And, so that improved and a lot of people went into it. And the famous writer Sylvia Plath wrote a book about this also called the bell jar. Some of the literary-minded people may have read about it. Okay, and this before this, people were trying for depression and something called insulin shock by lowering the blood sugar dramatically. So that was even much more risky. But electroconvulsive therapy still has a limited role now. Okay, but so it's still around, and it does work, but it's controversial. And the movie really painted it in a very, bad this thing. So it got a lot of bad reputation afterwards, Anyway, and it does cause short-term amnesia, by the way. And when it works, it really works. It really limps the. And there are a lot more things about. We'll talk about it as we move right along. But that's electroconvulsive therapy, and not only that, after the psychosurgery fell apart. Remember how people were doing a lobotomy? That was one of the worst Nobel Prizes that was given in the 50s to a Portuguese psychiatrist, neurologist named Dr. Moniz. Okay, and the most famous example was one of the Kennedy family, young woman who became almost like a zombie after having the frontal lobotomy. Okay, with a ice pick basically that was done, and there were about 1,000 cases done in the United States. Okay, by Dr. Friedman. Okay, so that's another dark chapter on history of medicine. Okay, but then things became a little bit more scientific in France, in Grenoble, of the deep brain stimulation, and that again required precise introducing electrodes inside the essential areas of the brain. The first that one it was used was Parkinson's. I showed you the little video earlier, in on day 2, I think. And there are even a lot more dramatic videos for Parkinson's tremors. Okay, and now as many as a couple of 100,000 have been introduced. It is also used for other illnesses such as essential tremors and into the cerebellar or the balance part. Okay, where the damages occur, where a precise electrode is inserted, under obviously close monitoring. A very low frequency stimulus. This is measured in hertz, Hertz. Okay, and that is self-administered basically. Okay, you can see that the stimulant is right around the shoulder. Inserted the neurostimulator, and the wires are channeled up to the brain and inside. Now again, remember that this is regular electric current. These are electron. These are so this is not natural proton electricity. So that and brain tissue does not like that. So you have to be careful about not overstimulating and causing damage to the normal tissue. Okay, so this is done in the called subthalamic. Thalamus is the little area like a walnut type, which is like a nerve center. All the impulses from above and below, like a relay center that takes place. Okay, and so this is stimulated, and this has advanced, and it can be used for a longer time, and it's become widely used since the 90s. Okay, so this is direct brain stimulation. Okay, now we have moved further, transcranial direct current stimulation. So varieties of diseases are used. Okay, and again, mechanism of action. Okay, it has memory effect of long-term potentials. Okay, it can cause various chemical changes, can occur with your neurotransmitters. Okay, and again, improves the connectivity overall. So it has now again on the whenever anything works, and improves your performance, and the military is always interested in it. So DARPA has spent a lot of money for this, and for improving the cognitive performance and of soldiers during the battlefield. And it can also be used during civilian use. It can improve your sometimes improve your mathematical skills and your creativity. Okay, so
Really?
so it, but again, it is, some people are using it and abusing it, type thing. And you can even get, through Amazon, brain stimulators like this. I don't think I would recommend it, but still, there is, money to be made in it. So people are selling over-the-counter devices. And if you see those of who would be read the Sally Addis book, she volunteered to go to the U.S. military facility, and after lots of pleading, and perhaps because she was an attractive reporter, she was allowed to go. And she played one of those video games of shooting the bad guys. And she was amazed and wrote an article in the science journal which she was working for called New Scientist, and that led to the book subsequently. So that was her introductory chapter. And so she was like, become the very popular and led to the research in this particular field. Okay, so there are a variety, and so these are more direct videos that are linked for those of you who are more curious about the material.
Curious.
I'm sorry, go ahead. Anybody has a question, please pipe in, because I can't see the chats.
Bharat,
Yes, please, go ahead.
I once was in a gym and there was a man there who had diabetes who was sitting in a chair and his feet were on two metal plates that were supposedly doing low electricity to his feet. That's not bioelectricity, is it? That's just real electricity. You know how they have neuropathy?
Yeah, I'm getting to that. I'm going to the TENS unit. Yeah, I have a slide coming for TENS
Good,
unit.
good.
Which, yeah, so I think coming up, I think, Bob is not here, but, at Rich Kennedy socially had asked me about TENS unit type thing. No, that's, there's a big slide coming up for neuropathy
Good,
type of.
thank you.
Yeah, so it's coming. So, but well, no. So this is like a hit and miss. Sometimes, there are varieties of organs, this is not a brain class, but you can see there are various nuclei in the front, which is a thinking part, the back, which is the visual part of the brain, okay, the temporal part, which is your auditory and linguistic, okay, the motor control in the top, just to give you a basic idea. Thalamus is somewhere in the middle right here, okay. And it can, when it works, it really works, but it's hard to predict who it will work for, sometimes. So it becomes like a little, and it can be used for varieties of illnesses, starting from depression, refractory to all medical therapy, okay, and obsessive compulsive disorders, okay. So, and those who maintain have a very good outcome type of thing, okay. And then sometimes, it can again backfire also, that it can cause some real compulsive behavior such as gambling, or and this sounds cruel or funny, whatever way you take it. One guy, after this direct brain stimulation, all of a sudden he became fan of Johnny Cash songs. So go figure that. He didn't care much for it before, but then managed to get all his albums of Johnny Cash. So the brain works in a mysterious way. That's all one can say. And people have, a lot of time, the people with Parkinson's disease have developed compulsive gambling to the point they lost all their assets. So it can backfire also. So it can, it is pluses and minuses. Okay, now this real busy slide is, it should have been, let's see if I could, okay, transcranial direct stimulation, magnetic stimulation. Okay, this is the, let's see, all right, ultrasound stimulation. So this is, continuous wave, pulse wave stimulation. So there are varieties of methods that, transcranial direct current stimulation, magnetic stimulation, okay, pulse wave stimulation, ultrasound stimulation, but ultrasound is a little easier type thing. So this is a very busy slide, but I think there are varieties. And the reason why there are so many approaches, because none of them are perfect, by the way. Okay, so this is, okay, TPBM is transcranial photobiomodulation. Okay, so this is done with, varieties of changes in electricity and varieties of solution. It kind of creates a field and works on the ions and the membrane potentials that we talked about. Okay, so So the field is still developing, and the transcranial ultrasound is becoming the big this thing that varieties of companies are trying to sell this to psychiatrists. Now, psychiatry did not have any procedure, so this is one way for them to monetize technology, so to speak, and people are trying to put them in their office, and you could find some groups of psychiatrists who own these big machines in their office now for depression. Okay, but then again, there is a potential for abuse as to, to pay for the device, they'll be generating more things. So, okay, but so, and this is, just varieties of head caps and cable connectors. So this looks like a space cadet type of thing. Okay. Now this is what you're asking about, the TENS unit. Okay. Okay, this is a low amount of electricity. This is the TENS unit with electrodes and patches. You can see that it is used for a number of conditions. Starting from facial pain, post-herpetic neuralgia. Okay, I doubt which will be used for angina anymore because we have a lot better technologies. Post-amputation pain. Okay, post-surgical pain. Okay, usually the most common use dysmenorrhea. Okay, primarily used for orthopedic situations such as back pain, osteoarthritis, bursitis, and last, but neuropathy pain can be really very intense and disabling. So, and again, foot surgery, you can see.
I use it all the time and it works.
Yeah,
Just
that's,
so you know.
it is, I think because as we talked about in the first class, electricity got a lot of bad reputation, and finally the medical establishment really looked that with, and once the genetics came around, electricity kind of fell by the wayside, and then also they ran into problem with funding for a lot of these devices, and the big companies were not interested in it if they didn't have enough, they're not able to sell enough, type of thing. So, but it is coming back into it, this thing. So that's where I may have mentioned Michael Levine's work, and it is coming back into it, type of thing. But people who are doing research were considered a little eccentric, and but finally they are getting their share of limelight, so to speak, and with advance in engineering, in bioengineering and nanotechnology, it is becoming much more feasible to scale down the voltage, because as you can see, instead of, they're talking about in terms of millivoltage, not even microvoltage. So it depends upon the instruments and how much we can downscale at a smaller scale in biology. Okay, because as we can talk about, how
Right, what does TENS unit means?
transcutaneous electrical nerve stimulator.
It's a abbreviation.
Abbreviation, yeah.
Yeah.
Oh my God.
Yeah, I think that's okay. So that's, so that is, it's been around, and I think you can, buy some of the ones. It's not regulated, so you can buy one from Amazon for less than a couple of $100, Okay, it comes with instructions and other stuff. So, but I think it's better to go through a professional, or at least a chiropractor or somebody who knows what they're recommending for, And
Yeah,
it works
that's
by,
true.
reducing the perception, because it kind of fools the brain by sending messages from a different part. It raises endorphin. And this came out back in the 70s, and it has exploded. The indications have expanded dramatically. Okay, so, and then similarly, those of you who have had some biology may recognize there is a nerve called vagus. What it means is a wanderer. It is the 10th nerve that starts in your nuclei in your brain, the cervical nuclei, and it goes all over. It's one of the longest nerves in the body. Okay, it not only goes in your heart and inside these baroreceptors, and remember we talked about the early research called vago stuff, the dream of scientist Otto Levy, where the heart rate slowed down. Okay, so that was the vagus nerve. Okay, and that was the discovery of the biggest neurotransmitter called acetylcholine. Okay, that's been around for 500 million years. Okay, evolutionary, that chemical. Okay, as a neurotransmitter. Okay, and So, and that goes to your gut and, all over spleen, and it's all over intestines. So there's almost like a parallel nervous system, okay.
Wow.
And that's, it gives you a feedback from your microbes, all the way to your brain and to your heart. Okay, so when you get nervous, you can faint because your heart rate slows down. Okay, and so there are varieties of systems that were devised to stimulate this nerve. This was suggested back in 1880, okay,
Mhm.
for migraine headache. I know it took another 100 years for the device to become technologically feasible in 1987. FDA cleared it 10 years later. So one can say this is like a pacemaker for brain epilepsy, for refractory epilepsy, and it alters the so-called chaotic rhythm that takes place in epilepsy, and it can also increase the level of the neurotransmitters such as norepinephrine or adrenaline, so to speak, and it can also be useful for other illnesses. The most recent one was the article that just came out. That's why it said for RA means rheumatoid arthritis. So it is, being used for varieties of other illnesses. Well, microregulator stimulates the vagus nerve. Okay, and it also works with T cells and macrophages. This is the immunology that Dr. Spector has talked about during COVID, and this year's Nobel Prize was for T regulatory cells. Okay, and it works with various inflammation. Now, inflammation is becoming the big, as we talked about, as cause of a lot of the illnesses, including heart attack, colitis, and everything else. Okay, and so this is, the vagus nerve stimulation is coming to the vogue because, but again, they are competing with something called the monoclonal antibodies. So how much role it will have, that remains to be seen. Okay. Yes,
Bharat,
Yes, please.
someone introduced me many, many years ago to massaging right underneath your ear, kind of up there, and that massage was going to your vagus nerve. And I practiced that an awful long time, and it really relaxes you. It's been around. It's like an African, from African tribes were teaching this whole massage technique or whatever, and to help people, regulate their body and stuff. This is old
it's,
science.
it's
Yeah.
hard for, but again, we're believe in Western science that unless somebody has done a double-blind controlled study, it's going to be hard to get accepted. Same thing for acupuncture, because
Oh, sure.
that's, that now some trials are being done, and obviously there is a role for it, and for the more. And now I think, my late friend Joel Fowland, who passed away at 95, because he was strong opponent of this type of alternative therapies type of thing. But now the people's demand are becoming such that even the most more famous medical establishment, such as Cleveland Clinic and Hopkins, are offering therapy called integrative medicine.
Mhm.
So if you go to Mayo Clinic, you can find an integrative medicine specialist. So they're offering, some of these things in acupuncture, even aromatherapy, and so maybe, so that it is becoming uh, more and more accepted type of thing. And I, read a lot of biology, and we are connected, with bacteria, and we may have talked about that. If it wasn't for viruses, you wouldn't have placenta, and we wouldn't be mammals, So, but again, I don't want to digress too much, And but so this is, there is a lot of interconnectedness that, we haven't looked at it, and perhaps we should, But anyway, so so this is, so there may be more to it than meets the eye. And I think I had, when I was looking up this class on brain, I talked about a UCLA neuroscience neurologist who had devised similar approach for Alzheimer's, and he was getting some good results. And similarly for heart, also with diet and everything else, Dr. Ornish had received good results before all the fancy treatment with complex stenting and other stuff came around, with diet and lifestyle and meditation type of thing. Back in the 90s, Dr. Dean Ornish approach was very
Mhm.
useful for people with really end-stage heart disease. But anyway, so that was much more integrative, holistic approach. Okay, so all right. Now, okay, we are coming up to 11 o'clock. Let me see how much I have left. So I think I have about 30 or 40. We should be able to wrap it up, yeah, because I have some interesting material type thing. So I'll talk about this is now BCI. I'm sorry for this abbreviation because I'm too lazy to type. Okay, this stands for, and I'm a lousy typist, by the way. That's why you see my emails that have a lot of typos. Okay, all right. So BCI stands for brain-computer interface. Okay, and stimulating brain directly has always been people's fascination from from the early days of Dr. Penfield, which we talked about, who mapped all this representation of body inside the brain motor and sensory cortex, and laid the pioneer work while doing surgery for epilepsy. Okay, so that was the start. Okay, and then obviously the EEG, which were recorded, and when people have trauma, they were able to record direct brain waves, so without going through skull. Okay, and then as the technologies improved, people started doing this, and there's a lot of research has been done earlier on the tails in the 30s and 40s, but and with the advent of transistor technology, the earliest one that was done was called something called Utah array, which had almost 100 micro electrodes that were implanted in a chip directly onto the brain surface, as you can see around here, implanted, a little chip that is, okay. And there are varieties of ways: invasive, non-invasive means outside, minimally invasive means on the brain surface, okay, implanted, not implanted, okay, intervention. So this is, more than one ways to skin a cat, so to speak. Okay, so these are, and then this is, I'm always, as somebody who does a lot of the looking up for the material, that Wikipedia has a great entry on this thing about the history of all of this, okay, as to how it started out from the early 20th century to present day. Now, then later on, a lot of the work was done at Duke University by a neuroscientist named Dr. Miguel Nicolelis. His father had a stroke, and that inspired him to work in this field. And he has done a lot of research about making people with stroke and spinal injury walk. Okay, so he was one of the earlier pioneer before this guy came about. Anybody recognize this name?
Miguel Nicolet.
Neuralink. No, I'm sorry, the
Oh.
Neuralink. So this name,
Really?
Neuralink. Okay, that is the Tesla man's another company. Okay, that is Elon Musk company. Okay, he has another company along with his
Oh,
space
yeah.
satellites. It's
Oh.
called Neuralink,
Mhm.
and that was one of his side ventures, and that is the brain-computer interface, and and they had implanted this in February of 24, okay, on a guy named Nolan Arbo, who was paralyzed, and you have to give him credit, his technology is far superior than the Utah array. He has about 1,000 electrodes on a small chip, okay, and it's obviously it's a groundbreaking work. And finally, this Mr. Arbo announced, in public, and he had given an interview just a few weeks ago as to how dramatically it has altered his lifestyle. Just by thinking, he's able to move and not, interact with video games and with day-to-day activities, and how the neural networks have learned, the brain has learned, and the brain plasticity has revolutionized this, and some of the earlier experiments. And I talked about in the late 1990, there was a neurologist in Atlanta named Philip Kennedy, and who did self-experiment because nobody wanted to implant a chip in his brain, okay, but he went to Mexico and experimented on himself. and darn near died with infection. So that, so that was a story that I read in one of the computer magazines. And again, DARPA, the defense agency, is spending a lot of money in it. But again, this electricity is electrons, not protons. Okay, so immune response and tissue reaction is a big problem. So if you have a huge contact, so that's where the micro technology. And before we take a break, I will say, but technology is advancing that Georgia Tech is coming out with a chip that is so tiny that can be inserted with electrodes between hair follicles. So you can imagine how small the distance is, and it can communicate. So that is now bioengineering is advancing with leaps and bounds. And there are a lot of crazies which are so-called transhumanisms. And there was some Australian guy that I had read. He's one of the first ones who had a big chip implanted in his brain and his arm, and is almost like a bionic man, so to speak. So, but transhumanisms, that attracts a lot of crazies or pioneers, whatever you want to call them. So that's the thing about, and it is making some dramatic this thing, and some of the data, at least from patient one, the data from Neuralink was, and a lot of this is done in animal experiments in chimps who are able to manipulate objects on the screen and this thing. So brain and computers have been working together for a long time. So I think if you would like to pause, Mr. Ballard, and then we can.
Okay, recording's on.
Okay, thank you, sir. Thank you. We'll go ahead. Okay, so we talked about the brain-computer interfaces. So it's a brave new word, I think, basically. So I have about another 40 slides, so I should be able to finish in time, so won't delay too much. Okay, now the spinal regeneration issues. Okay, so this has always been a dream of regrowing nerve cells, because initially there was this impression that nerve cells will not regenerate. Once it's lost, it's lost. But it turns out that is not true. Okay, and a lot of research was done at Purdue University, by on electrical fields. Okay, and there were some pioneer researchers there. They were concerned with not just with action potentials, but generating what is known as fields of the electricity. And again, this was not widely accepted by the mainstream science, but luckily for him, he received funding from some businessmen. So Purdue had a very active lab working on regeneration of not just animal research, but mammalian research. Okay, once a scar is formed after injury, because spinal cord injuries are common with car accidents and motorcycle and so on and so forth. So, and the problem with this thing is that once the cell is cut, it has a tendency to die back, so to speak, so that doesn't want to recover very quickly. So stimulating this, and because the body's reaction, just forms damaging environment to the growth. So this is, instead create, a disastrous area where the scar tissue forms. Okay, and let's see if I can zoom in on this. Okay, see non-regenerating axon, fibroblasts, and other things, so it causes, issues with varieties of cells that come and prevent this. Now, some of the smaller animals which have regenerative capacity, their behavior is a little different, so those were good models to study. Okay, and so by creating an electrical field, they were able to show some evidence for regrowth of spinal cords. So this was a research that was done with something called oscillating field stimulator at Purdue University. Okay, and unfortunately, at the same time, some of the researchers formed a company, and they decided to hype the publicity of their results. And then some of the results were hard to, when they were not ready to publish, basically. So the hype, did not live up to the original result. And then, as it happens quite often, the funding died up, and so that really, it caused a big setback to the people who are doing research. Some of them went on elsewhere and continued to work with the field. Okay, and this is, another device for the spinal cord injury that is called RSEX. As you can, the site of injury, electrodes are placed, and it generates biphasic and monophasic electricity. This is still experimental, okay, investigational, non-invasive stimulation with spinal cord injury. And again, obviously they're not going to be playing Olympics, but as long as they can control their bladder or their vital functions, people are very realistic. They don't have unusual overall expectations. But it does, show some promising results. So it's some pioneering people have continued to work with this thing. And some of these things was, obviously the football players were big victims of spinal injuries, and whereas philanthropists, and this was, again, we talked about, the funding had a big issue, and if they were able to get some type of a touch and human touch back, and the axons of the nerves endings have tendency to go towards cathode, that is a negative charge. Okay, and the initial experiment was done on dogs, which were more similar to mammals, as humans, because obviously you can't do experiments on. And they asked for a lot of dogs who were paralyzed and were, walking on two legs with prosthesis. So they got tons of dogs available, and that, their results were dramatic when they presented it at conference. Okay, and so this was, and then finally the FDA approved for human trials. But again, this was, the paperwork and other these things caused a problem with FDA approval. And again, the money and the research money had became, so there was a company called BrainGate that I mentioned earlier. Okay, so this was all done in sometime in 2005 at Purdue. Now, and okay, and moving on to a different field, electricity and wound healing. Okay, so this was suggested that the wounds generate electrical field. Okay, this was proposed back in the 19th century by Italian scientists. Okay, that the skin potential is negative, and as when there is an injury, some of the cells rush in, and by stimulating the electrical field, okay, it can promote healing based on endothelial tissue. The epithelium is always negative. That's may explain why you get tingling when you bite your tongue. Okay, and so this is, because all the cells, have kind of layer, outside layer and inside layer, basically. And so this has a big potential, because not just for military, but also for regular citizens. And somewhere along the line, it was one of the researchers at Purdue had developed something called derma recorder, which was a device to measure skin voltage. Obviously, we're talking about very tiny amount of voltage, okay, that is generated. But his device that is shown here in this thing, was able to record the skin potential. Okay, you can see, so it was a very elaborate machinery type of thing, but it did improve the, technology and give an investigative tool to the people who are working in the field. Okay, so electricity and the fields are coming back into some ways, and the cells have a tendency to move towards the electrical field, and this is useful not just for wound healing, but even in early embryos, it is useful. The cells have a tendency to migrate towards electrical current, the individual cells. I may have a video coming up, so, and then it's also useful for, in cancer metastasis. So the fancy word electrotaxis or galvanotaxis means tendency of the cells to migrate away from the positive or negative electrode field, So this is, again, this was known for a long time, okay? And there are fields inside developing embryos that might regulate the migration of varieties of cells which form the facial face and nervous system, okay? And there are varieties of enzymes that translate the electrical signal into direction, okay? So this is seen in the tiniest animals, such as sea squirts, and even in individual cells, okay? And this is, another cartoon diagram of how positive and negative, and but the varieties of ions, the cells would migrate. Okay, let's see if I can show that. There is no sound on this one. You can say this is the cathode. And this is the nanowire that they're talking about. I think that was it, I don't think it's any, you can just see the. Okay, so that's, and this is obviously, the cell does not have a brain, but somehow there is enough, voltage channels that lets it migrate. Okay. And again, this was, and some of the researchers' name was, Lionel Jaffe at Purdue. Okay. And again, they were working with brown algae to study how these cells were migrating. Okay. And they, and they were working with eggs of these algae to see how the ion currents were directing the embryonic development. Okay. All right. So they were lining up, sort of fertilized eggs. Okay. And when the tube was exposed to light, the embryo polarized and generated a micro voltage. Okay. And calcium was obviously important for this. Okay. So they were working with something called the vibrating probe, so that they could, that has nothing to do with sex, by the way. Okay. They could measure the voltage gradient generated by this individual brown algae eggs. Okay. And this was research that was done in 1970s, okay, and to study ionic current about regenerations. And they also work with frog muscle cells. Okay. And so this was some of the groundbreaking work that was done by this couple of people who continued to work in the field in spite of skepticism from mainstream action potential guys. Okay. And this is somehow I could not copy this, but I will have to send this out. This is a video about the migration of the cells from a more recent video, but this is from Princeton Proprietary, so I could not copy it, but I will try to show it later on if we have time. It's a more, a better narrated video on wound healing. Okay. Okay. And this is, I just thought this was something interesting. And electronic tattoo, this is, a wearable device with sensors that transmit data electronically. It can be attached on your body to track anything of electrical impulses and chemical composition. So it's, it's really almost becoming futuristic, so to speak. You can just see how you can transmit your signals type of thing, So, and so this is, just for show and tell, it's, a bit interesting. And again, how the electrical fields, are, emerging from activity and transmit information. Okay. And these fields have becomes to very complex mathematics. And for those of you who have some interest or background in advanced mathematics, this works with something called Fourier transformation of the fields and waves. Okay, about so people have done a lot of interesting work on measuring or manipulating these fields, type of thing. And again, this has a role in the brain-computer interfaces. And this way you can direct the growth of these tiny nerve cells. Okay, and it at least works in the animal models of a type of thing. And I think, and this was, again, this research fell by the wayside. It was suggested by some scientists in Eastern Europe in 1940s, but during the wartime, the information did not get transmitted more to the West, and then again fell by the wayside with the advance in genetics type of thing. So literally, so electrical fields, one can say that somebody's statement was the unseen conductor orchestrating our symphony. So it's not just spike a single on and off type of thing, but there are varieties of fields, and this may play a bigger role in in generating consciousness and in interconnectedness type thing. Okay, and the word that I mentioned in the first class, that the word that aphatic coupling, okay, means the adjacent. So if you are the adjacent nerve, the field affects, so it doesn't have to be directly action potential and neurotransmitters, but just sitting next door, we are kind of reaching out and well, and there is a lot of side talk that is going on under the surface, and that may be playing bigger role than what we realize. Okay, and last but not the least, bones have different voltage, but there is a role for electricity in bone healing as well. This is called piezoelectric, means pressure sensitive to electricity. Okay, and let's see what we can show you about pressure can be converted to energy. And again, bones are rich in calcium and phosphorus. Okay, so again, there is voltage there. So there can be a role, can sense just the mechanical force that can be converted into electrical stimulation to improve fracture growth and mitigate bone loss. So there may be a role for that coming up, I think. Okay, and so that is, there are no field is almost exempt. Okay, and now this is more scary, that cancer cells are more positively charged, and that way they literally hijack the energy from the other cells. May have mentioned that cancer cells can actually extend tiny microtubules and steal energy from regular cells. So it's really kind of a rogue cells, basically, that they take over, just to hijack normal machinery. Okay, and then just that they have selfish interest in multiplying. Okay, so there is a big role of this. So there's a lot of this is there are some references for the electrical language in especially in breast cancer. So this is fairly recent data from November of this year. Okay, and again, ion channel in gynecological cancers as well, there is a role for it. Okay, endometrial cancers, all of these have varieties of ion channels are related. You can see that the names are immaterial, but you can see both all those cancers have electricity that is involved in cancer therapy. Okay, so it's opening up a new person based on ion channel expression. People are deciding what type of medical approach that they should take. Okay, so yeah, and so this is, one can say that the cancer cells are literally rebel cells. They hijack the other properties, okay, and change the potential from -70 to 0, and create chaos in general. Okay, and this and then the ion channels become abnormal. That leads to the spread. Okay, And then again, there are certain animals that are resistant to it. For example, the naked mole rat that do not get cancer. So they are being used for research of or for this model. And again, a lot of research is done by a Turkish scientist who works out of UK. And initially, it was, his research was looked down upon. That didn't make sense, but now it's being accepted that electrical current in malignancy does play a big role. Okay. So in other words, in every textbook, talks about cancer is disease of genes. Basically that was the big hallmark of cancer. But there is more to it than meets the eye type thing. So okay, and in other words, instead of declaring war on the cancer, managing cancer may be a better approach type thing. And okay, all right. So and again, the cancer is a disease of how the cells migrate type of thing. So when the tumor is removed, and this is a lot of research done in salamanders or other organisms, that when part is removed, the tumor tissue becomes normalized and almost they can form a whole healthy limb. As we advanced on the evolutionary scale, whether we have lost the ability and can we retune it, and that remains to be seen for future. Okay, and to reprogram some of these cells to correct the anatomy by electrical stimulation, that is the holy grail, so to speak. Okay. Okay. And this was an interesting book that I may have mentioned that called The Rebel Cell. This came out not too long ago. How, again written by English a PhD scientist named Kate Arney, about about the malignant cells and how they refuse to act. And a lot of the research is done by a field called optogenetics, by stimulating cells with light. And this was one of the 1903 Nobel Prize was done for treatment with light, okay, for treating cutaneous tuberculosis. Okay, so light has been used, and now the field has advanced further by using light and stimulation of the brain cells, and okay, so it's altogether coming together varieties of disciplines of physics, computer science, and bioelectricity is coming in together. Okay, and now this is interesting that during cancer surgery, surgeons always have a difficulty. They wait to see how much to cut. Okay, and this led to some of the horrendous side effects from breast cancer surgery that women, with the Halsted operation that was done at Hopkins, they removed all the lymph node and they were left with massive swelling of their left arm and lymphedema, and caused a lot of other disfigurement and problems after surgery. And so this is one way to decide as to what is the edge detection during cancer. A lot of times, as if those of you are familiar with surgery, surgeons will wait for do a biopsy and send it out to pathology while they're operating and see if there is cancer cells, and then go on with further dissection. So, but instead of that, detecting bioimpedance, the electrical voltage change at the edge is being used in Europe, not so much in the United States, but this is called bioimpedance. And this is one way to monitor it for lymphedema as well, called the change in voltage devices have used to identify invasiveness of cancer margin. And it can reduce the need for more repetitive surgery by measuring how far. And there are varieties of dyes that are used, bioelectric dyes, to measure how much to cut and how much to leave alone, what is normal tissue. Okay. And so electricity is, has a role at birth as well as at death. Okay. And there are voltage spike during ovulation. I talked about, the Yale scientist in 1930. So he was measuring voltage not during women at the time their ovulation. Okay. And again, even in men, two sides, two fingers, there can be a voltage difference. Okay, and so, and during mid period there is voltage spike during ovulation. Okay, and so, and this has a role in vitro fertilization. Okay, and again, sometimes there is a big role for calcium, that sometimes egg will turn into embryo with calcium without necessarily a genome needed. Okay, so there is, a role of calcium is been underappreciated type of thing. So, okay, let's see if I can zoom in on this. Okay, and this is just the basic anatomy of the ovum. So, and you can see how this sperm neck has calcium store. Okay, and again, there are the varieties of ion channels we talked about. There's an ion channel inside inside the sperm. Okay, okay, and so ion and electrocytical channels are just about everywhere, right from your birth onwards, so to speak. And now, all if you remember Dolly, the cloned sheep, okay, and this was, the egg that was taken, the nucleus was removed and was reinserted, and this is the, um, you can look at it at your convenience. This was the groundbreaking work that was done for cloning. But last but not the least, to stimulate the egg, he did use electrical current, so. Those of you who are a fan of the movie Graduate may remember, Elaine got started in a Ford. So, pardon Dolly, you got to start with a spark. Okay, so this was, electrical stimulation for the egg that was used by, uh, by the British researchers, when they created, the cloned sheep back in 1978, I should say. Electrical pulses were given, as you can see at this level, to fertilization to get the started. Okay, now obviously a lot of the work was done even before the knowledge of calcium channels and other stuff became available. Okay, but the same idea is being extended. So this cartoon is from Encyclopedia Britannica. So one can say it is, you can see how the nucleus was removed and was reinserted in cloning the clone sheep Dolly. Okay, and the body has a plan called morphogenesis, basically. So that is a lot of the work that is being done by Michael Levine about, about the body plan and the axis left and right symmetry that is being done. Okay, and the varieties of voltages of different cells have. Okay, the stem cell potential is almost zero, and the cancer cell can be positive, and certain different cells of the body have different voltages. So that's the importance that I wanted to get across. And by so skeletal muscles have a minus 90 that we talked about in the earlier. Skin has nerve cells are minus 70. Fat cells have relatively a lower or minus 50. I'm sorry, higher rather. Okay, so different cells have different voltage potential. Okay, and we talked about, the ion channels have a role in embryo development. Okay, and again, we talked about, there's, so, a huge number of genes have some roles, type of thing for positioning of dextrocardia, which I showed you earlier. And this can be created inside laboratory, not by necessarily doing gene manipulation, by tweaking the ion channels and the voltage. Okay, so you can change the polarity of the body, the axis, the left to right, front to back, so to speak. So this is this is almost, Frankenstein type work that you can change. Obviously, you won't do this on human experiment, but especially on frogs and other animals, that can be done. That they can change the polarity of the organ formation called morphogenesis. And I may have mentioned that in the first class, a lot of this work was done by the great computer scientist Alan Turing, how the pattern can be changed based on a self-organization that can take place by changing the polarity and axis with stimulation. Okay, so it's a lot of this. Now, again, we talked about the main problem was that outside electricity is electrons, In the body, that is hydrogen ions. Okay, so it's a different charge that takes place. But inside the body, there are varieties of called proton pump. We talked about the earliest, the main one that keeps you and I alive is oxygen, and the respiratory change called electron transport change. That if you, in the second class, we talked about scientist named Peter Mitchell, who did the work on this, the complex proton pump that creates a formation of ATP. But there are other proton pumps that are there inside the body as well. Okay, and so this is, so they're everywhere, not just in the body, but inside individual nerve cells. And so it has, so this type of electrical charge has a huge role in, each and every cells. It's only now that we're able to measure these voltages with a better instrument technology. Okay. And this is again, this again works right after fertilization. That sometimes, after fertilization, channels can become one-sided, and if you mess with them by adding extra channels, that can create almost a total havoc, and the whole plan of the body, the left to right and front to back orientation, can get disrupted. Okay. Okay. Now, this was uncovered that the bioelectrical signals grows the tadpoles to grow eyes in the back. Okay. Okay. You can see this is, like where the voltage is manipulated, causing deformities inside animals. You can see that the frog can grow eye on its butt, basically. Okay. And so this is again, the bioelectrical code has a huge role to play in animal regeneration. The varieties of small animals have the capacity to regenerate, okay, including flatworm, sea star. The biggest prototype was organism, from South America, axolotl. Okay, it can, even when the limb and spine is cut off, it can totally regenerate. Frogs, they start out with tadpole and can regenerate limbs, but lose the ability in the adult. Okay, now adult humans can regenerate. So this goes down with the, and sometimes, this you may or may not realize, until age of 11, you can, if you lose fingers, you can regrow fingers. Unfortunately, in the West, we would be exceptionally worried about leaving the fingers unwrapped, and so when we wrap it up and try to keep it clean, that does not let it grow. But sometimes in the developing world, if people don't have resources or a very complex hand and plastic surgery to reattach, this will grow back. Okay, and so in Sally's book, there is an example of a kid who was from Philippines and his fingers had grown back. Okay, so it is, the human cells do have potential, I think. Okay, and so there is a lot of, interesting things that we are just learning. And the same way, the liver cells can regenerate. And then same way, the part that regenerates without your and my realizing our intestinal lining and the lung cells. Okay, so somewhere along the line on the evolutionary tree, we have lost the ability to regenerate, and so the hope is, and then again, the big organism that people work with, the small organism called planaria, and that it can stop the growth by putting a toxic element, barium. Okay, and what does barium does is blocks the potassium channel, and somewhere along the line it can work around it and can regrow the head, basically. So the regenerative capacity of some of these organisms is amazing. Okay, and again, they've taken various dyes, giving color to the voltage, and that way they can actually manipulate, monitor the ion channels when they are manipulating. So, and after 40 days, the frog's leg that was cut off, basically regrows, and they were able to see how the cells are self-organizing and migrating. And this way, again, you can see that the frog is able to grow the eye on its butt, basically. Okay. So, and And let's see if this one plays. I think I'm just going to let it talk by itself. I just was able to download it this morning. Okay, come on, play. Okay. Oh, okay. But hopefully people can read this, otherwise I'll try to. Okay, so these are sort of xenobots, means, xeno is frog. Okay, they're cells taken from skin cells. Okay, and they're with biocompatible material. They're somewhere along the line they're able to form cilia, means little hair cells on themselves, and becoming literally self-organizing balls, so almost like a novel living machines, that are created. So this is, and this, a lot of that is used with artificial intelligence and bioelectricity. So this is a lot of the work that, that is being done, as to really, I don't know what they would call them, whether it is actually new life or new living machine. Okay. Okay. And this is, I think we already talked about the electrical stimulation of the nerves. So I think we're almost coming to the end. Okay. And there are varieties of other methods because the problem comes in with the tissue reaction. So a lot of times, it was thought that plastic would not convert, but a couple of researchers in Japan and in US had used polymers as conductors with electricity. So they're able to create new material taken from coral for bone regeneration and tissue regeneration, so that were to avoid tissue reaction possibility. Okay. And again, so varieties of cells that are used from squids and varieties of protein. So where we're using sort of protons, again, avoiding the problem that occurs with, the usual electricity as we understand. Okay. So this is, different type of material being used to avoid the body's immune response. Okay. Okay. So this type of protein, it transported protons, which is, a way to duplicate nature, what it's doing. Okay. And again, we can get away with a lot smaller voltage than what we can do, scale down with standard electricity. Okay. And again, so this is, you've all heard of transistors, but this is a mass, almost make you, turn 180-degree turnabout, proton-based transistors, So this way, you can literally see this is a machine and human interface, type of thing, can communicate with living things, Okay. Again, we're borrowing the ideas from sea animals, okay, the biomaterial that is conducting protons and interact. Okay, so this is a device that is overlaid on graphic of other components, and this is called chitin type of different type of proteins, and so this again communicates, with voltage, and this is injected inside frog embryos, and so you can actually control the voltage. So we can see the interface of computer science and biology. Okay, so this is again, and DARPA is heavily interested in this, and this can be used not just for tissue regeneration, but for delivering drugs at the local site, avoiding side effects. Okay, and we already talked about the wound healing, so this is a duplication. Okay, so we are coming to the end. So there are varieties of roles for molecular type, cellular level, and again at the tissue level. So each have big problems as well as solutions that are being used with new materials, in manipulating stem cells, and not only just creating artificial organs and various medical devices. And for those of you who want to know more physics, this is an interesting video by a physicist who is interested in biology from an institute called Aspen Physics. So I think we are coming to the end, and hopefully we had fun. Okay, end of the slideshow, and we'll see you sometime in future. Thank you, folks. It was fun.
Okay, thank you.
Okay, all righty, and we will send out the slides, and I think some of the videos may be interesting to people who are